This is Doug Brunk for Global Medical News Network, reporting from the annual meeting of the Minimally Invasive Robotic Association in San Diego.
You know, there's a set of technologies that have come together right now. It's a combination of the internet providing information at the point it's needed with the best information in the world, sensor technologies for monitoring how patients are doing, cloud computing applications. So if you combine these things together, it's the ability to put the right information in the right place with a patient whose history and record you know, with robotic technologies that can help patients manage their medication, get around, and make sure they're following their doctor's instructions. This has an impact on chronic disease that's profound, and chronic diseases today consume 70% of the healthcare dollars.
How soon will we begin to see some of these advances be used in the day-to-day care of patients?
You know, it's funny. William Gibson says the future's already here, it's just not evenly distributed, and that's really where we are now. A lot of these technologies are already here, they're just in pieces. What's necessary, now you see things like pill boxes that give people reminders. You see technologies that help people with mobility and assistance. You see technologies that help people monitor their health. What you need, though, is integrated platforms that bring them all together, make them simple to use for patients, make it easy for family and caregivers to check in on patients, and make it easy for doctors and patients to participate together in their care. That's where we're coming. It's really beginning to expand at a rapid rate, and in the next 5 to 10 years, you'll see a revolution.
Is there anything else that physicians should know about robotic technology advances coming down the pike?
You know, I think the main thing for physicians to think about is that we're moving into a much more patient-centered world, where people want to manage their own care, they want to understand what their choices are. Robotics gives a way to amplify. It's not about replacing people. It's about amplifying what physicians and nurses and caregivers can do, extending their reach through distance and time, and extending their best practices to individual patients' conditions.
For Global Medical News Network, this is Doug Brunk.